Mr. Smith. It's nice to meet you. My name is Erica O'Brien. I'm a registered nurse, and I'm working on obtaining my graduate degree to start as a nurse practitioner, and I'll be the one working with you today. Have you worked with a nurse practitioner in the past?
No.
Okay, great. I am currently studying to be an acute care nurse practitioner. Nurse practitioners work to independently manage health care and to help you achieve optimal health. We work with patients to diagnose, order tests, write prescriptions, and place referrals as needed. Okay, Mr. Smith, to get started, how would you like me to formally address you?
Mr. Smith's fine.
As a part of your health history today, we'll be asking some personal questions, and I just wanted to let you know that all of this information will remain confidential unless you are a harm to yourself or others. Is that okay with you?
Yes.
And I will also be taking brief notes. Is that all right?
Yes.
To begin, can I have your full name and date of birth?
Robert Smith.
And your birthday?
11/12/86.
And what brings you in today?
Just a job.
When was your last examination?
A few years ago.
Okay. And what were you seen for then? Just a checkup or?
Just a checkup.
Okay. And was everything normal at that time?
Yes.
Do you have any medical history? Go ahead.
Just asthma and heartburn.
Okay. And any mental health conditions?
No.
Do you have any concerns related to your current state of health today?
No.
Are you current on your immunizations?
No.
When was your last tetanus shot? Do you know?
Probably years ago.
If you had to guess.
So 4 or 5 years ago.
Okay. Have you ever had a TB test?
No.
Okay. How about the flu shot?
No.
Okay. Are you up to date on your hepatitis B vaccines?
No.
Have you had any exposures to any communicable diseases such as hepatitis B or TB?
No.
Do you have any allergies to any medications, food, seasonal or environmental factors, specifically an allergy to penicillin or latex?
No.
Have you ever been hospitalized or had any surgeries?
No.
How about emergency room visits?
No.
Have you ever had any accidents, injuries, or harmful ingestions?
No.
Do you take any medications on a regular or as needed basis, such as prescribed medications, over the counters, any vitamins or herbal supplements?
Just Prilosec for that.
And do you take that daily?
Yes.
And is it one tablet or?
One a day.
Okay. So no other over-the-counter medications, vitamins, or herbal supplements?
No.
Do you use any sort of complementary or alternative therapy, such as acupuncture, chiropractic care, spiritual care, special diets, or vitamin therapy?
No.
Let's discuss family history, and we'll go over your immediate family members, which includes your parents, aunts, uncles, brothers, sisters, grandparents, or any children. Are your grandparents alive?
My mother's parents are and my father's are.
Okay. Do you know of any family history of allergies?
No.
Asthma?
No.
High blood pressure?
Yes, my father had high blood
Okay. Heart disease?
pressure. My father died from a heart attack.
Okay. Any neurological concerns such as seizures? Diabetes?
Yes, mother and father.
Okay. Cancer?
No.
Thyroid disease?
No.
Any blood disorders?
No.
Obesity?
No.
Vision or hearing problems?
Everyone in my family has glasses.
Any congenital diseases such as birth defects or genetic diseases?
No.
Any emotional or mental health concerns?
No.
Learning disabilities?
No.
Behavioral concerns?
No.
Drug or alcohol abuse?
No.
Are you concerned about any illnesses of a family nature?
No.
Do you have any siblings?
One younger brother.
And he's healthy?
Yes.
Do you feel safe in your home?
I do.
And who do you live with?
My wife?
Okay. Do you feel like she's a good support system for you?
Yes.
And what do you do for a living?
I'm a utility worker.
Okay. And what kind of work does that involve?
Physical labor and things of that nature.
Okay. What past jobs have you had?
I used to drive truck.
Okay. Have you ever had to change jobs because of a health concern, hazard, or exposure to violence?
No.
Do you feel as though your family has the resources it needs as far as financial obligations, health insurance, and for primary and inpatient care?
Yes.
What is your highest level of education?
Associate's degree
Okay.
college.
Do you currently or have you ever used alcohol?
Yes.
How often?
A couple of weeks.
Okay. And what do you drink?
Beer.
And then when you drink, how many beers do you have?
2, 3.
Do you use tobacco products?
I do not.
Okay. Have you ever?
In the past.
Okay. Was it cigarettes or?
Yes.
Okay. And how long did you smoke for?
10 years.
And how long have you quit?
8, 10. I think it's been.
And when you did smoke, how much did you smoke per day?
Probably a pack a day.
Do you drink any beverages that contain caffeine daily?
From time to time.
Okay. Any recreational drug use?
No.
Do you feel as though you sleep well?
Yes.
Okay. And how many hours of sleep do you get per night?
I try to get at least 8.
Okay. Do you exercise?
From time to time.
Would you say once a week or more or less?
Less.
What do you do for exercise?
Walking.
Okay. To help me understand your diet, could you provide some information about the food that you ate in the last 24 hours? So we could talk about yesterday. Did you have anything for breakfast?
I did not.
Okay. Is that usual for you?
It is.
Okay. And then for lunch?
Salad.
Okay. And for dinner? Do you feel as though you get an adequate serving of fruits and vegetables daily, or?
From time to time. Not always.
Okay. Do you drink water?
I do.
How much would you say that you drink in a day?
A couple glasses a day.
Okay. 8-ounce glasses?
Yes, at least.
Do you feel as though you have stress in your life?
From time to time.
And how do you cope with those concerns?
Just trying to relax at home. Hang out with my wife and friends.
Okay. Have you ever sought outside help for those concerns from a mental health professional or a chaplain?
No.
Have you ever witnessed or been exposed to any emotional, physical, or violent abuse?
No.
Let's talk a little bit about the safety in your home. Do you wear a seatbelt?
Yes.
Okay. How about a bike helmet?
No.
Do you ride a bike?
I do not. Motorcycle?
Do you wear a helmet?
I do not.
Do you have functioning smoke and carbon monoxide detectors in your home?
Yes.
Is there a fire extinguisher in your home?
Yes.
And any guns in the home?
No.
Are there any current or past exposures to health hazards such as crime, violence, pollution, secondhand smoke, lead or radon in your home, work, or community?
No.
Okay. Do you have any specific religion affiliation?
No.
Okay. Is there anything related to your religion that would affect your health care?
No.
So let's begin a little bit of the review of some systems. Have you recently had any fevers, chills, fatigue, night sweats,
No.
weight change?
No.
Are you having any pain today?
No.
So you'd say that's a 0 out of 10 on a scale of 10 being the worst pain you ever had?
Yes.
Okay. Any change in your skin, moles, or nails?
No.
Do you wear sunscreen
when I need to.
when you're out in the sun?
Yeah.
Okay. Have you noticed any changes in your scalp or changes in the distribution of your hair?
No.
Okay. Do you wear glasses or contacts?
I wear contacts.
Okay. When was your last eye exam?
4 months ago.
Okay. Have you ever been told you have glaucoma or cataracts?
No.
At your last eye exam, was everything normal?
Yes.
Any hearing loss or discharge noted from your ears?
No.
Any ringing in your ears or dizziness or spinning?
No.
You wear hearing aids?
I do.
Have you had any recent colds, runny nose, sinus pain, or infections or nosebleeds?
No.
Okay. Any missing teeth or dental problems?
No.
When was your last dental exam?
Oh, probably a couple years ago, 2 years ago.
And was everything normal there?
Yes.
How often do you brush and floss your teeth?
1 to 2 times a day.
Both?
Try to.
Have you noticed any stiffness, swelling, lumps, or tenderness in your neck?
No.
Okay. Any lumps, soreness in your breast or discharge from your nipples?
No.
Okay. Have you been feeling short of breath, experienced any wheezing, coughing, or shortness of breath?
No.
Okay. And you said you have a history of asthma. Have you had any recent exacerbations?
No.
And you take no medications for that?
No.
Have you ever had chest pain or been diagnosed with high blood pressure, heart murmurs, or hyperlipidemia?
No.
Okay. Do you experience any diarrhea, constipation, or change in your bowel habits, having to strain to have a bowel movement?
No.
Okay. Any nausea or vomiting?
No.
Any abdominal pain?
No.
Any food intolerances?
No.
Okay. Rectal bleeding?
No.
And any swelling in the glands of your groin?
No.
You did mention that you had heartburn. Can you tell me a little bit about that? How often do you have heartburn?
If I don't keep on my meds, it'll happen almost daily.
Okay. So the Prilosec helps you.
Yes.
Is there anything that makes it worse for you?
Beer?
Okay. Any other aggravating factors?
Not really.
Do you notice it at a certain point of the day, morning, night, evening, worse than others?
In the mornings, if I don't keep up on
Okay.
medication.
Do you feel as though it disrupts your life in any way?
It can.
Can you explain that a little bit?
If I don't keep up on the meds, it's just difficult to deal with.
Are you able to do daily tasks that you normally do, go to work and those other?
Yes.
If you had to rate your heartburn today, where would you say that it's at?
0.
Okay. And if you don't take your medicine, what would you say your heartburn is at?
Would depend on what I eat.
Okay.
Anywhere from 0 to 5.
Okay. All right. And again, the medication does help for you.
Yes.
Okay. Do you experience any urinary frequency?
No.
Blood in your urine?
No.
Incontinence or flank pain?
No.
Any sexually transmitted or urinary tract infections?
No.
Any discharge from your penis?
No.
Are you circumcised?
Yes.
Okay. Do you have any children?
No.
Alrighty. Do you have any fertility desires or concerns?
No.
Have you ever had a prostate exam?
I have not.
Okay. Are you sexually active with men, women, or both?
Women?
Okay. And how many lifelong partners have you had?
1.
Okay. And how many current partners do you have?
1.
Okay. Do you use any form of contraceptives?
I do not.
Do you feel as though you have any limitations in your range of motion, any swelling or weakness in your joints or back?
No.
Okay. Any pain or stiffness?
No.
Okay. Do you have a history of a head injury?
No.
Okay. Have you ever lost consciousness?
No.
Do you have any numbness or tingling in your extremities?
No.
Any seizures or tremors?
No.
Headaches or impaired cognitive functioning?
No.
Any memory impairment?
No.
Okay. And any irritability or mood swings?
No.
Have you ever been anemic or had a low blood count?
No.
Have you ever had a blood transfusion?
I have not.
Okay. Do you have a tendency to bleed a lot?
No.
Okay. Any thyroid problems or unusual sensitivity to hot or cold environments?
No.
Okay. Any excess hunger, thirst, or urination?
No.
Okay. How would you describe your overall mood?
Happy?
Okay. Would you consider yourself overall generally healthy?
I would think so.
So you're of good health?
Sure.
Okay. Do you have any history of anxiety or panic attacks?
No.
Depression or mood swings?
No.
Any hallucinations?
No.
Any suicidal attempts or ideations?
No.
And any eating disorders that may have needed treatment?
No.
Is there anything else about your health that you are concerned about today?
No.
Well, this concludes my health history examination. It was a pleasure to meet with you and thank you for your time.